Recently we covered a topic on angina. Now let us review some questions that can be tested on NCLEX. We will test our knowledge with just 10 questions. The answer and rationale for each question are provided in this video. Okay, then let's practice together. Question number 1. Which of the following best describes stable angina? I repeat, which of the following best describes stable angina? Choice A, occurs at rest and is relieved by nitroglycerin. Choice B, unpredictable and not relieved by rest or nitroglycerin. Choice C, occurs during physical activity and is relieved by rest or nitroglycerin. Choice D, persists for more than 30 minutes and is associated with nausea. Now take some 10 seconds and write your answer. If you have a pen and paper, write your answer, and then we will look at the answer and the rationale. Okay, then now I think you have your answer. Let's compare. The correct answer is choice C, occurs during physical activity and is relieved by rest or nitroglycerin. Stable angina is chest pain or discomfort that typically occurs with exertion or stress and is relieved by rest or nitroglycerin. Question number 2. The nurse is educating a patient with angina about lifestyle modifications. Which statement by the patient indicates a need for further teaching? A nurse is educating a patient with angina about lifestyle modifications. Which statement by the patient indicates a need for further teaching? Choice A, I will aim to engage in regular exercise within my limits. Choice B, I will try to reduce stress through relaxation techniques. Choice C, I will avoid all foods high in saturated fats and cholesterol. Choice D, I can continue smoking as long as I limit 8 to 1 cigarette per day. Take about 10 seconds. Pick your answer. Thank you. I know by now you have your answer. Let's compare with our answer here. The correct answer is choice D. I can continue smoking as long as I limit 8 to 1 cigarette a day. Smoking is a major risk factor for angina and should be completely avoided. Question 3. What is the primary goal of treatment for a patient with angina? What is the primary goal for treatment for a patient with angina? Choice A, eliminate all chest pain. Choice B, prevent myocardial infarction. Choice C, promote complete bed rest. Choice D, prevent myocardial infarction. Well, take your time, 10 seconds. Pick your answer. You now have your answer. Let's compare with our answer here. The correct answer is choice B, prevent myocardial infarction. The primary goal in treating angina is to prevent a heart attack, a myocardial infarction. Question number 4. The nurse is administering sublingual nitroglycerin to a patient experiencing angina. What is the appropriate frequency for administering this medication during an angina episode? The nurse is administering sublingual nitroglycerin to a patient experiencing angina. What is the appropriate frequency for administering this medication during an angina episode? Choice A, every 5 minutes for a maximum of 3 doses. Choice B, every 10 minutes for a maximum of 5 doses. Choice C, every 15 minutes for a maximum of 2 doses. Choice D, every 30 minutes for a maximum of 4 doses. What do you think is the right answer? Well, the correct answer is A, every 5 minutes for a maximum of 3 doses. Sublingual nitroglycerin can be administered every 5 minutes for a maximum of 3 doses during an angina episode. Question 5 is a quick one. Which of the following is a common side effect of nitroglycerin administration? A, hypertension. B, bradycardia. C, headache. D, diarrhea. Take your time. I know you have your answer by now. The correct answer is C, headache. Headache is a common side effect of nitroglycerin due to its vasodilatory effects. Question number 6. A patient with angina is prescribed a beta blocker. What is the primary mechanism of action of beta blockers in treating angina? A patient with angina is prescribed a beta blocker. What is the primary mechanism of action of beta blockers in treating angina? Choice A, vasodilation of coronary arteries. Choice B, decreased heart rate and contractility. Choice C, increased oxygen demand on the heart. And choice D, improved lipid profile. Pick your answer. Now let's compare with our answer. The correct answer is B, decreased heart rate and contractility. B for boy. Decreased heart rate and contractility. Beta blockers work by decreasing heart rate and contractility, reducing the oxygen demand of the heart. Question number 7. Which of the following conditions is a risk factor for development of angina? Which of the following conditions is a risk factor for development of angina? Choice A, low density lipoprotein, LDL, cholesterol level of 70 milligrams per deciliter. B, hypotension. C, diabetes mellitus. And D, regular aerobic exercise. Pick your answer. Well, by now you have your answer. Let's compare. The correct answer is choice C, diabetes mellitus. Diabetes mellitus is a risk factor for the development of angina due to its association with atherosclerosis. Remember we mentioned atherosclerosis? Yes, the deposition of plaques in arteries. Question number 8. A nurse is caring for a patient with unstable angina. Which of the following intervention is the highest priority? A nurse is caring for a patient with unstable angina. Which of the following interventions is the highest priority? Choice A, administering a scheduled beta blocker. B, administering nitroglycerin as prescribed. C, initiating cardiac monitoring. D, arranging for a stress test. This is a priority question. Take your time, read through the answers and pick your answer. Good, let's compare. The correct answer is C, initiating cardiac monitoring. For a patient with unstable angina, cardiac monitoring is a priority to assess for changes in rhythm or signs of myocardial infarction. For a patient with unstable angina, cardiac monitoring is a priority to assess for changes in rhythm or signs of myocardial infarction. Question number 9. A patient with angina asks about the purpose of sublingual nitroglycerin. What's the nurse's best response? What's the nurse's best response? A, it helps to dissolve the plaque in your arteries. It relaxes the blood vessels around your heart, improving the blood flow. C, it decreases your heart rate to reduce stress on your heart. D, it provides immediate pain relief by numbing the chest area. Well, your answer, let's compare with what we have here. The correct answer is choice B. It relaxes the blood vessels around your heart, improving blood flow. It relaxes the blood vessels around your heart, improving blood flow. Sublingual nitroglycerin works by relaxing blood vessels, leading to improved blood flow to the heart. Our last practice question is question number 10. Which of the following activities should a patient with stable angina be encouraged to engage in regularly? Which of the following activities should a patient with stable angina be encouraged to engage in regularly? A, jogging for 30 minutes every morning. B, swimming laps in a pool. C, walking at a brisk pace for 30 minutes most days of the week. D, lifting heavy weights in a gym. Pick your answer. Now let's compare. The correct answer is C, walking at a brisk pace for 30 minutes most days of the week. Regular moderate exercise such as brisk walking is beneficial to patients with stable angina. Thank you for watching this video. I hope these practice questions have helped you widen your knowledge on angina topic. Again, welcome and kindly subscribe to my channel for more content. Goodbye.